Hi everyone, happy Wednesday. I am excited tonight. I have a dermatologist on, Dr. Mahoney. Hi everyone, let me get Terry on here. Here we go. Hopefully everybody will hop on. And there you are. Look how easy that was.
That was easy today.
Wow, that was so easy.
Am I
My
echoing?
goodness. Nope.
I have my microphone on.
Oh, good. Did you have the little ones?
Yeah, it's right here.
The little round one? Oh, perfect. No, that's
I
good.
hope this is working. My battery is down. I was charging my phone. I was like, damn, I got to get on. So Dr. Mahoney should be on in a second.
Okay, hold
I
on.
was
Let me,
coaching him.
all right, let me make
It's
sure.
under WDH dermatology or WH something.
Hold on. I've got to, hold on.
Hey,
What's it
everybody.
under, Terry?
W,
What is it?
WDH,
Uh-huh.
WHD.
WHD.
Mhm.
Okay, let's see. WH. Oh, there he is. Okay.
Look at
Invite.
this. Look
All
at
right.
wow.
I know. Look at this. We're getting this down. It only took us a couple of months, right?
Hi,
That's
Peg. I
okay.
miss
I know.
you.
I miss you too.
Oh.
Okay, so let's see if we can get him on. Accept. All right, I did an invite. So you walked him through it?
I sure did. I told him press on it and he should get on. I told him exactly what to do.
WDH, right? Is that what you said?
Mm-hmm.
Or WHD? What was it?
WHD, West Houston Dermatology.
Okay, West Houston. Got it.
Yeah.
Okay, let's see. Okay, invite. Boom. Invite again.
He needs to look and he needs to just, I told him what.
WHD Skin Doc. Okay.
Yes.
I know it takes him a little bit. So hopefully. Did you guys go through it once or twice with him?
Well, I did. I told him, yeah, I showed him what to
Okay,
do.
good. Is unable to join. Okay, he's unable to join. Let me
He's
keep
got,
trying.
yep.
Let's just keep trying. WHD. Let's just keep trying. Usually takes invite.
If not, I'm going to go to the text and I'm going to tell him what to do. Oh, there
Oh,
he
there
is.
he is.
Hey.
We made it.
Yay. You made it. Fantastic.
This
It's
is
a
all
little
new
So,
tricky.
territory.
It's a little tricky.
This is all new territory.
okay,
Yeah, I know.
everyone, welcome to our Not Podcast, where we have the best and most updated medical stuff. So I've got Dr. Steve Mahoney here. Do you go by Stephen or Steve Mahoney?
Depends if I'm in trouble.
Okay. So
Steve is perfect.
anyway, he is a dermatologist here in Houston. He's been my dermatologist for how long?
We've probably been known each other for probably 30 plus years. I hate to admit that, but I think it's true.
Yeah, I went to him because he was cute.
Oh,
And,
well, as you can see, things change. So
but anyways, I still see him, and he's got an amazing practice here in Houston. He's not only has a medical side to the practice, but he's got an amazing cosmetic side to his
Mm.
practice, and I've done both. And so, welcome. I'm glad you decided to join us, and take it
well,
away.
thank you for
Sure.
having me.
And
So
this is
ask away.
Peg.
Yeah, that's okay. Hi, Doctor. How are you? Thank you for coming on tonight. We really appreciate it.
Well, thanks for having me. I hope to bring some informative stuff. We'll see what you have to, anything you want. Go
Oh,
ahead.
I'm sure. I'm sure. Well, I want to talk about varicose veins, is what I like to kick it off with, because getting older in my 60s, I have this big patch of varicose veins on my leg. What's the best thing to do to get rid of them?
It kind of depends on the size of their, the caliber of the vessel. If
Let
they're
me see.
smaller, yeah, you can, I don't
Here
know
we
if I
go.
can
Wait a
even,
minute. Wait a minute.
But
There we go.
hold on. I
What?
don't have any
What?
because he
those are
lasered them
okay.
off. Remember?
Oh, really? Okay, there they are right here.
So that's a good size. That's not bad at all. So the best thing for that would either be a combination of sclerotherapy, where you inject a sclerosing agent that causes those veins to kind of collapse on themselves, or like Terry said, you can do a laser. but there's only certain, it's kind of like with hair removal. Not every laser is built the same. So you want to make sure that the people you go to, and it depends on your pigmentation. People that have kind of more olive skin, some of those lasers will knock out the pigment too, and so you'll end up with, it look terrible. So you have to use like a laser it's a 1064. That's the nanometers on it, and that would be like a Q-switch YAG or something. So those are the kind of like hair removal lasers and vein lasers that are good in any pigmentation type. So you can do it in really, dark Hispanic or, darker skin types. If people are tan, you can still do it. Where if you do, which is more of a 532, which is more like superficial, that will take out pigment. So you don't want to do that.
So
So whenever they go, they should ask what the wavelength of the laser that is being shot, because they want more of a 1064. That's the numbers they want.
So I've had both. I've had this, what do you call it, where they inject the fluid into the vein? What's that called?
It's called sclerotherapy.
I've had sclerotherapy, and it's immediate. It does sting a little bit, but it's immediate. And I also did the laser. So with the laser, though, what is the healing? Because it did take, I love it. My results are amazing, and it didn't hurt. But what is the downtime? There isn't downtime, but the healing time, because I know that I had some brown little spots from the healing. Do you remember that?
Yeah, and so it depends on kind of how big the veins are. The healing is usually, I usually tell patients, give it at least a month. If you're ready for shorts and swimsuits and stuff like that, you want to make sure you give it enough, at least a month to kind of fade. Because like Terry said, sometimes you can get whenever there's inflammation in your skin, it's kind of like when you skin your knee. Sometimes it'll stay dark, even though the skin's healed, because the pigment from that skin drops down into the dermis and it'll stick around. Now you can do a laser on top of that to take the pigment out, but that's also giving you another couple weeks to heal. So if you really want to be on the safe side, I'd say probably anywhere from 2 to 4 weeks. 4 weeks on the top side.
Do you need to stay out of the sun when you have that procedure done?
It kind of helps, because as that skin's healing, you're getting new skin. And sometimes if it's, exposed to a lot of intense light, it'll darken, like Terry was saying. It'll get, then you'll trade dark spots for the vein being gone, which is not what you want. So, but if you time it right, and if you do the thing you showed me was a plexus, and that's like a tree. It's like a connected thing. And so when you do the sclero, you can get into like the main trunk of the tree, and you can inject, and it'll shoot through all the veins, and it'll just knock them out with like one stick. And so that can be really nice, because then you're not poking a lot, and you only have one place where there'll be maybe a little bit of a bruise. Terry was saying it can be painful, but what I always do is I put normal saline right after I inject it. So you have a little bit of pain, like a little crampy, where it's going when I shoot it through, but I immediately knock out the pain with some normal saline. So a lot of people don't do that, and then it kind of just stays achy. And I don't want it to stay achy. It also will limit the kind of bruising you get at each little injection site, because you're poking into a vein. So when you pull out, it's going to bleed. And so, you want to kind of minimize all these little side effects that can happen, because they stick around, for a month, and that's just it's not a good look.
How about a topical? How about a topical painkiller that they have? When you
that doesn't work, because all that's going to do is because the pain is the deeper, like that visceral pain, that kind of achy pain, and the topical won't help that. It'll help the needle stick, but the needle, we're using like a 30 gauge needle. It's really small. It's not the stick that hurts. It's the flushing of the hypertonic saline solution or the sclerosing agent. I use hypertonic saline solution because I can vary the concentration depending on the caliber of the veins. So like if it's a bigger one, I'll use a little bit more of a stronger agent. But if it's really these small little like spider ones, I don't need a bazooka. I can do something a lot lighter.
Okay. Yeah, I get mine done every year, Peg.
Do you? You go in and get them done?
Every year, and it's not many, but
we just do little touch-ups with the laser most times after that.
Oh, that's great. What are they caused by? Just what are varicose veins caused by?
Well, I think a lot of women get them in pregnancy, because they're carrying, extra weight, and they've got the pressure here that's making the blood kind of flow backwards. But also, I think if women cross their legs the same way every time, they'll get it around like where they create pressure. So a lot of times you look at your leg, it's like, why do I have it back here behind on my calf or on my thigh? Well, you probably cross your leg that way. It's hard to learn how to uncross your leg. You tend to favor the same way every time. So a lot of times
where I get mine? I get mine on my left thigh, because when I put the patient's dental chair back, that back of that chair rests on my left thigh. And
Right.
that's where I get my little small veins. And then sometimes on the back, but it's as we get older. Now, for the really large veins, I guess, is that an in-office procedure, or do you have to be sedated, or how do you get rid of those?
It depends. If they're really big and tortuous, those are some that, radiologists do it now, some invasive radiologists, where they'll actually stick a catheter in and they'll either, tamponade it or they'll laser it. But when they're kind of more like your size or smaller, you can do it in the office without any anesthesia. We put you in a soundproof room, but that's about it.
All right, let's get to the cosmetic side. I come in and I see your esthetician, Janet, who is amazing.
She is the best.
And everybody always asks me about my skin. I've had the Cutera laser. So that's what I use. It's just the results have been amazing. And can you talk about that procedure as well?
Cutera.
Well, the Cutera laser, there's called the Cutera XLV, and it's a combination laser. It's got a KTP laser and a YAG, tunable YAG, and so it works on those two different wavelengths I was talking about, 532 and 1064. 532 is the same. The target is hemoglobin, and that's so that when you inject the laser, if you're trying to get face veins or you're trying to get varicose veins, it's targeting that hemoglobin. So any laser, it'll go through a substance until it finds its target, then it delivers all its energy. So the stratum corneum and the epidermis basically has no targets. It's like light going through a window. If there's nothing in the window to absorb the light, it just passes right through. Well, that's what lasers do. They pass through until they find their target. So if we're doing tattoos or we're doing whatever, we tune the laser for like green dye, red dye, black dye, and it will just pass through until it hits that target, and then it delivers all its power. And so the same thing what Terry says. So the Cutera is nice because I can change it from 1064 to 532. So if I'm going for browns or I'm going for reds, I can just pick my target. And I'm doing, like brown lentigos on the face, or, if you get the back of your hand, you get those age spots. You can target those, and then I can just change the laser settings, and I can go for red spots or veins. So it's a very versatile laser. It's been one of the workhorses in our practice for sure.
And describe the procedure, because it was so easy. Took 40 minutes maybe, and no pain whatsoever, and my skin looked amazing. It still looks amazing. So just describe the procedure.
Well, that's the one you can use the topical numbing, because that will definitely make a difference. You will not feel it. So we usually put numbing on the patients like 20 minutes before they come in, and then Janet or myself or we'll kind of take off the numbing, and then you just put on some protective goggles so that you don't expose your eyes, and then as Terry says, you just point and shoot, and it's pretty cool. We can change the size of the aperture of the laser. So if we need a big target, we can open it up. And if we need a small target, so if people have kind of like flushing here on the face, we can do a bigger spot size and kind of cover the territory without as many, pulses. And it's the same is true with hair removal. You want to be able to, you can open up your spot size, and you can do bigger areas. So you're not just kind of like painting a wall with a roller instead of a little paintbrush.
Yeah, laser hair removal is great too. I've had that done. I had it done on my upper lip.
I wouldn't say that was painless probably, but
it wasn't bad. You know what was really bothering me? It wasn't the discomfort at all. It was the burst of light, because I've had vertigo, and it was those bursts of light that I could kind of feel a little bit through those dark glasses, but that works too. But the Cutera laser, I have it done. I've had it done, I think 3 times so far, and I totally noticed the change in my skin, and it's not that expensive. So I think that's something that people who are looking for a nice, affordable solution for their skin, it's a good option. Would you agree?
Oh yeah, it's definitely, it's one that you can see immediate changes. I mean,
Oh,
as you're
wow.
watching it, the vein just goes away, or the brown spot just, and I mean,
How about
Terry
your
takes great care of her
chest?
skin.
Yeah, how
It's
about your
perfect for that.
chest? Is it?
Yeah, that's,
Wow.
if you look at, women wear blouses more often, so they've got that little V of the chest. We definitely see, sun changes and aging, and it's a great way to kind of just clear up all that stuff, so that you don't have to feel self-conscious about
Right.
wearing, spots. That in the neck too. So it's just a really neat laser. We've been really
So
fortunate to.
one of our listeners, Rhonda, is asking, do you have any information to tighten your neck or your jowls? Any info on
You
things
know,
you can do?
well, necks are tough, and even plastic surgeons will tell you that. It's just because it's such a dynamic area, and it's one of these things that I always tell my patients, you
Ooh.
got to put sunscreen on, just because it's so hard to save that. Even
Right.
if you kind of tuck and pull it, which they'll do a little excision here, and they'll kind of like a mini face or a lower facelift. You still have the skin quality, and if your
Mm,
skin quality is kind of beat up, even if you pull it, your skin is still, it's damaged. So um, the kind of treatments there's some good CO2 lasers now that are kind of like the
mm,
Fraxels. They're kind of a profractional, where Fraxel laser is a CO2 laser that's kind of like a honeycomb. So you're getting different pulses throughout the spot size. You're not just burning the skin down to a certain level, because then you have to be careful. If you really, this skin is very sensitive, and if you get too aggressive with it, you can cause scarring. And that's,
oh.
you know, that's that's right in a visible area, and then you can't really fix it. So these CO2 profractionated ones, it's like a honeycomb, where you get some areas going deep and some areas not being touched. So you have
Mm,
those little areas around to heal the deeper areas, but you're able to go down into the dermis where the collagen fibers are and the elastin, and you can kind of tighten it. It's almost like when they're branding a cow and you touch it with a hot thing, the skin it'll kind of tighten, and that's what it's doing on
mm,
a dermal level. And that way you're not just trashing the top to get to the bottom,
mm.
because in certain, if the skin is already kind of damaged and thin, if you get too aggressive, you can cause some scarring. And
What's
that's the
the
whole.
Wow.
what's the downtime on that? Is that done with, I mean, that it's uncomfortable, or I don't like
It's not.
pain.
It's the old Fraxel lasers. People had to be put under, or they would give them laughing gas, or they would give them like an IV sedation because it was uncomfortable. Or the plastic surgeon would say, when I'm doing your facelift, I'm going to laser your face, uh,
Mm,
and they would do that. These ones that are the newer ones, they're not as, they've kind of dialed back on some of the power, so you can actually tolerate them with just some topical numbing. So we do faces, neck, hands, even some of the like the underarms, where you get the kind of crepey skin on your inner upper arms. Those are great areas to do, and you can tolerate it without having to be, either general or regional anesthesia. You can just go ahead and do it. Now the healing
What?
time is probably about 2 weeks, maybe a week, and it's
mm,
actually, it's not bad, because it sort of feels real sandpapery, but it's almost like you've kind of got like a rug burn on your face. It's not like, your skin's not going to be raw. You're not going to have open areas. It's very, you can't really necessarily put makeup over it right away, because your skin has been, the epidermis has been changed, and if you try to put makeup on, it'll just get all kind
mm,
of bunched up and not
mm.
look good. But you don't have to disappear for like 2 weeks or a month, like some of the old people that got the real aggressive CO2 lasers used to be like, you better lay low for a while, and that's not the case anymore.
How often do you recommend a CO2 laser? I've never had that done. I'm a little bit
Mm.
afraid, to be quite honest, just when I saw in the past. But how often should that be done? Just once, or?
We've had some. It really depends on kind of where, like when we do resurfacing of the hands, like the top of the hands, we'll do a treatment about every month for like 3 months.
Oh,
And
wow.
if you were kind of worried about how it was going to do on your face or your neck, try your hands first, or try someplace that you can cover, that you're not going to be sitting there feeling. And
Man.
once you feel like, hey, my skin does okay with this, we've had people start with the hands or the upper arms, and then they say, wow, that was great. And then they go to their chest or their neck. I mean, obviously, you want to I always tell people, do a limited area, because your body does better if it heals in like segments. If you go do a whole bunch of stuff, your body's kind of like going, it's got to heal everything. And it can't just focus on stuff. So if we're going to treat someone's face, let's just do the face and maybe the neck. Let's not go much more, because we want that to heal properly.
So I
And
have a question for you. So when you're removing that layer, right, it comes
mhm.
back, is it going to come back a little lighter than it was? I've heard that
Yeah,
it does.
well, yeah, I don't think you're going to be able to look at someone and say your face looks lighter than your neck. Like you have to kind of treat the whole thing, but it will take off those little brown discolorations and kind of the photo aging effects that you see, which is nice, because that's sort of a double-edged sword. You want to get the dermal tightening, and you also want to get the tone and texture to get improved. I mean, that's what you want, because it's the whole package. When you look at someone and you really say, wow, you've got great skin, it's probably because they've got that fullness, that suppleness, but they also have, the pores are tight, and the tone is even. Because if you have one without the other, it just doesn't look right. If you get too much sun and you've got a bunch of age spots on you, but your skin is full, it's almost like, well, they've just done some fillers. They haven't really done maybe the whole deal. And I think it's like anything else. If you look good on your body, it means you probably, you work out. And I think it's the same way with people's skin. If they take good care of it, like Terry's, you look at him, you say, wow, your skin looks great. It's because I work at it. It's not just, there's some God-given stuff that happens that people just are blessed with, certain good qualities, but it's because they take care of it.
Well, I was a lifeguard growing up.
There you go.
So, yep. And I used baby oil, but around 28, I decided to stay out of the sun. So most of the damage for skin is before you're 20. Am I correct? Or before you're
About
25?
probably 80%, they say. That's what it's been quoted at that. And you think about it, that's when we're really totally in the sun. And then maybe we have kids and we're out chasing them around, we get more sun. But most times when we're in the working, we're like, I'm in an office all day, so I'm not out there really cooking myself like I was when I was a kid.
I will say you walk the walk because you have great skin. When I
It's
was in
just
the office a while back, I thought, you've got great skin.
this is an avatar, so you haven't really seen the real me.
It's like a cosmetic dentist better have good teeth, right?
Right,
A
right.
Yeah,
dermatologist better have good skin.
you have to walk the walk.
Yeah.
Whenever
Yeah.
when I get sunburn, I hear about it from my staff. It's like somebody wasn't paying attention. So
Uh, so we have one of our listeners, Diana. She just had the CO2 laser. Diana, yeah, she said she just had it a couple of hours ago. It's four
Wow.
hours old. Yeah, interesting. Yeah,
what does she look like?
yeah, that's what she said. If I can send you guys a picture, I would. But that's all right. Yeah.
They've really improved the technology. From when it first came out, it was pretty harsh. And I think, like anything else, they've learned how to keep the energy delivery, but make it with the timing of the pulse gyration. You don't get as much heat in your skin, so you won't have as much that big kind of overkill. So it does take probably, you were talking about how often you do it. I would say we tell people to do it once and then maybe come back in 6 months if they want to, improve it. But a lot of times they may be happy with the results. So it's just, I think if you're going to do uh, things like arms and hands, you have to be sort of sequential, because we're not trying to do too much. So we try to do probably 3 treatments about a month apart. And then that way you can kind of, each time we can get a little bit more aggressive, and go deeper and deeper. And we can target the areas that may need like a second pass or two. So
So
Interesting.
let me ask you something. So one of our listeners said, where does one start? So
Yeah.
for anti-aging for your face as we mature, where should you start for prevention? I know you're going to say to stay out of the sun. That's a given. But just facial routine, Retin-A, vitamin C, lasers. Where do you start?
I think if you had one thing to pick from, you would do like a vitamin A or Retin-A. And
Mm.
a lot of people can't tolerate Retin-A because it's retinoic acid. So the pH is lower, and sometimes it's just too strong for them. And that's why you're seeing a lot of retinols now, whether they be part of over-the-counter stuff or, people are promoting them because that's the aldehyde version of the retinoic, uh, the acid, well, retinoic acid, but it's the vitamin A. So as a result, it is a higher pH and it's better tolerated. So you can see those in concentrations like 0.1, 0.2, 1%, 2%, kind of depending on. And the nice thing about them is you want to find whatever strength you can tolerate that you can use every day. Because some people use Retin-A and say, oh, I can only use it twice a week. It's hard to kind of be consistent with that. And I don't know if you're really doing as much good if you're kind of like cooking yourself a little bit, then letting it rest for a couple of days. You better to find a strength that you can do daily. And so that's where you were saying what you do. The three things that help to kind of build collagen and help with rejuvenation would be vitamin A, which is like a Retin-A, a vitamin C product, and probably a glycolic. Those are the three things that have sort of been proven. But you have to, the problem with products is you look at them, you have to have the right concentration. Like for vitamin C, it has to be at least an 8% free ascorbic acid to be effective. And if you look at some of these products that people sell, you turn it over, you can't see what the ingredients are. I mean, they may say, oh, we have vitamin C or vitamin E, but you don't know what the concentration is.
Can you give a
And
recommendation? Like I use SkinCeutical vitamin C.
I think SkinCeutical does a good one. Image is a nice one. Revision has some nice products too. We try to carry a few lines so we don't kind of overwhelm people. And then we try to carry different price points and we try to carry different strengths. And that way, if someone says, oh, I can tolerate, the strongest Retin-A, the 0.1% Retin-A, well, then you want to have something. There's always prescription products that you can write for, like the Retin-As, they're available. And then there are the vitamin Cs, there's no prescription product that's out there. So you'd have to look and see kind of what Terry was saying, which one you favor. Some of these put like ferulic acid with them. You have CE ferulic, that's the SkinCeutical one. And those are good too, because you're adding extra antioxidants. And those antioxidants are things that are going to stop the sunburn cells and kind of keep you from not only rejuvenating, but then not getting skin cancers. And so you have to know what the concentration, like certain molecules, like vitamin E is too big a molecule. It doesn't penetrate the skin. So if a product has vitamin E in it, it's like, that really doesn't do much for me because it's just going to sit on the surface. It's not going to penetrate. And it's the same thing if you don't know the concentration. There are products that say, oh, I have vitamin C in there. But if you don't know if it's at least an 8 or 10% free acid, then it's like putting an orange on your face. I mean, you're getting this, it's not going to do anything. You're getting vitamin C on your face, but it's not going in and doing anything. So I always tell patients, if we're going to take the time to putting stuff on our face, let's at least make it worthwhile. Let's at least have a concentration and a strength that we know is going to do something. And you'd like to have something where you put it on, and let's say you forget over a weekend, you go, gosh, I can see a difference. I forgot my stuff. You want it to be that kind of a topical where you feel like, if I miss this a couple days or even a week, I really see my skin looking duller or I don't see it the same. I think if you're going to spend the money, you want to have something that gives you that kind of wow effect. You're worth it.
How about a retinol for your arms? Because I worked outside for 25 years being a firefighter, arson, bomb tech, and my arms, they just have a lot of age spots, and I would love to do something for my arms.
Well, obviously a Retin-A is great on those where retinol. The problem with a lot of those things is the sample size they give you is so small that if you try to treat a large area, you're just going to blow through it.
Right.
A lot of times the glycolics do better on the arms and the legs because you're going to get the same exfoliation, which is what you really want. You want to get those brown spots off or that skin to be tightened, and you're not going to kind of burn through it where you've got such a small, like every day I use something called Glytone, and it's got a body lotion. It's got an SPF 15. It's got 14% glycolic. It's got one that's got 17% too. But when I put it on, it just keeps my skin tighter, smoother, and it doesn't let those little brown spots come up because it's like every day you're getting a peel. Every day your skin is kind of exfoliating, but on a light, you're not just like red and peely. So that's the thing you have to watch. Some people go, oh, I use Retin-A. It's like, yeah, I can see you do. Your skin is falling off. And that's just not a good look.
So I've got two questions. One comment. I use the glycolic, the
Hmm.
Glytone.
Glytone.
Do not
Glytone.
shave your legs and put it
Yes.
on immediately after. It will sting like nobody's business. It
Yes.
will. So do not put it on after you've shaved your legs fresh.
Yeah.
And the other thing is I use retinol 0.25. Is that a good one?
Yeah. I think that's, you probably used a 2.5, not
2.5.
0.25.
2.5.
Yeah. Because you can get stronger with the retinols. Like the Retin-A, they do have a 0.25. That's like the mildest form of Retin-A. And then they go to 0.05 and then zero point 0.1, so that's, you kind of climb the ladder and see what you can tolerate. I always tell patients, use the strongest one you can tolerate.
Is it good to put a moisturizer on top of it after you put the retinols on your face? A
It
moisturizer?
does, yeah, it definitely helps. It doesn't, they used to have one that was out, they were now kind of, Altrino makes one, and Avita that had like a little moisturizer in it, so it was more tolerated for people. So
Okay.
I do think the moisturizer is great if you can find one that kind of, that I always tell people, whatever, if you like the way it goes on, that's what's important. Because if you don't like it, you're not going to use it. So
Mm.
just find that moisturizer you like and you can blend it with it.
So I was told that vitamin C in the morning and then a moisturizer and then retinol at night. Is that correct?
Yeah, because retin-A's can be photosensitive sensitizers. So if you live in Vegas and we live in Houston, you're going to put that stuff on and you're going to be out in the sun and you have more
Mm.
chance of it kind of damaging or causing sunburn and stuff like that. So if you do it at nighttime, you're protected. And then during the day, vitamin C is not a photosensitizer or the glycolics. And so you can get away with them in the mornings. Like Houston has 300 sunny days, just like, California and Vegas. You're in the sun a lot, whether you want to be or not. You can't help it. So it's good to have some sort of coverage every day that you're just going to avoid that.
But Dr. Mahoney, unlike Vegas, we have our state bird is the mosquito.
Yes, exactly.
What is our state flower is the tumbleweed? Oh,
We're getting into the
okay.
mosquito
Oh,
land.
here's a good one. What are your thoughts on estradiol for the face? That's a great question.
I think it's great. I think we're seeing a lot of, one of the problems with postmenopause, there's multiple problems that come with that, but from a skin standpoint, not having that estrogen is a big deal with your oil production. So you get dryness, you get kind of sagging. We're seeing that the use of estradiol, it depends on the concentration, anywhere between 0.1, we have a 0.3 in our office that we write for, will cause not only better hydration, better tone, but it improves collagen and elastin production. So
Mm.
when I see, I it's much more of a product that I would give to a female than a male, obviously. But I do think it's a really good thing to put in the morning if somebody kind of feels like, since I've gotten older, I have that kind of dull look, and I just don't feel like my skin is the same it was before. I went through estrogen, probably through menopause, and in the old days, they used to just give people estrogen and say, here, we're going to put you on Premarin, whatever. And now, because of the
Mm-hmm.
concerns of breast cancer and stroke and heart attacks, that they're very reluctant, and any HRT tends to be kind of low dose estrogen. And it's whether they use a cream or, pills or a pellet or something. I think topical is great because they've shown that doesn't have the absorption doesn't put you at risk for these other, things they worry about. And you
So
can
when do
still
you
get
when do you
the
place
benefits.
it? Look, we got vitamin C, we got retinol, we got glytone. When do you use the estrogen on your face? At what point in the day? What
Well, you can't use everything, so I don't
right.
try. I try to look at patients and kind of decide what do I think they need the most. And I
Mm.
think a vitamin A would be kind of across the board something I would choose. And if they were kind of complaining that, since they've gone through menopause, their skin just isn't right, I would try the estrogen in the morning. And then if we could get away with a glycolic with a sunscreen, great. But if we can't, I would just stick with those two. And then maybe use the glycolic on their arms, like you were talking about, where you really have a bigger surface area and you want to do a little more exfoliation.
Can you do Glytone, whatever? Can you put that on your face? I thought it
I
was
do.
just you put it
I
on your face.
every day. I put it on my face, my neck, and my arms and hands. And
Wow.
I'm like you. And after I shave, I'll put it on, and it stings, but I kind of like it. It lets me know that that acid is
You're
working.
you're
I did not
alive.
know it could go on
Yeah,
your face. Interesting. I use it on my body, but not my face. Okay, I
yeah,
learned something.
yeah.
Okay.
You should. I mean, I agree. It's hard to put everything. You have to kind of find the things that work. You don't want to have too many steps because it's not that it's not. Sometimes you put two acids on your face, like the ascorbic acid would be a vitamin C, and then a retin-A. It's kind of two acids, sort of, kind of fighting each other. So I try to keep those two apart. Now you probably could do the estradiol and then add a vitamin C to it. I don't think that would complicate either one of them. Which order you'd put, I don't know. I'd probably put the estrogen first because I want to get that absorbed. And that's kind of like I always put the sunscreen last. I don't want to have the medicine to work through a sunscreen. I'd rather have
Mm,
the medicine right on my face and then put a sunscreen afterwards. And I always tell people you can wait, put the medicine on, brush your teeth, go do something, and maybe, put the second one on. So you're not just putting on goop and goop, it just gets hard to know what's really been absorbed.
right.
So there's a lot of stuff out there. It can get real confusing. And
There's a
that's why,
lot.
and I think that's why it's real important to kind of know about concentrations because the way the skin works is by gradients. Things get pushed in by, it's like a slope. And so if you don't have enough of a gradient, it's not going to get absorbed. It'll just sit on the surface. And if it sits on the surface, it's not going to do anything.
You
It
know,
needs to,
they've been talking a lot about that. I don't mean to interrupt you, but the molecules are too big. So there's been a
yeah,
lot of talk about that in the beauty industry. It's like, no, we're going to go to smaller molecules. They
right.
have these eye patches because they have my eye on my eye bags, but they were talking about how they have these little pricks or little thorns or whatever it is to go into your skin to deliver those smaller molecules to get into the dermis epidermis of your skin in order to get in there and help regenerate all the collagen. What do you think about those?
Well, I don't think the pricks make a difference. It's not that it needs like to be poked in.
Okay.
It's more, the skin is a fantastic barrier. I mean, God made a great thing. It's meant to be a barrier. It needs to keep
Mm,
stuff out. And so
mm,
it's more, are there receptors and are there things that can actually draw this thing in? So it's not like you can force stuff through. And whether you put a patch in with little pokes, now that being said, it does do better sometimes to put, when we do microneedling, we do certain things, we're
mm,
causing damage to the skin. The reason microneedling works is because you're creating little trauma. It's like when you cut yourself, your body makes new skin to heal it.
mm,
If you cut yourself too deep, it makes a scar. So you
mm.
have to kind of cut yourself, do enough damage where you're going to trigger the body to make new skin and regenerate, but not so much that you're going to, cause it to scar. And the
Okay.
same is true for if you're causing a little bit of damage to get medicine through, but the molecule still has to be something that the body can accept.
Mm,
If it can't accept that, or there's not a transport system, then it's just like water. It'll take it in, but it's just going to lose it. It's
mm,
got no place to store it. So if you're putting these things on, whether it be a retinol or a vitamin C, there are mechanisms and there's actual toll-like receptors or receptors in the skin that are ready for those. And then when they get to see it, it's like, oh, we know what this is. Now we know what to do with it.
mm.
So when people are putting collagen, your body has to know what to do with that collagen. You can't just give it collagen because it doesn't, you know, it's not like the body's processing collagen on that level. You can break the build. So when they talk about the peptides, they're trying to give the building blocks of proteins and of collagen. So we're going to put those proteins in our skin and hopefully our body will then use them. Well, to a point it can. If you exceed your body, it's just like if you take a bunch of vitamin C, your body only has so much need for vitamin
Mhm,
C. The rest of it's just going to get heat out.
mm,
It
um,
can't store it. So that's the same thing with some of the stuff we're putting on. We can go crazy and put stuff on that's got no place. The body is not going to know what to do with it. It's not going to help.
right, right. Okay.
So some of these things are a little gimmicky as far as I'm concerned. They're there has to be, like, I haven't seen enough science in journals to really support these peptide collagen creams. They'll say that, there'll be studies out of them, they'll show this, but I haven't seen enough of a groundswell for me to just adopt that. When I'm doing things for my patients, I want to know that there's science behind it. I don't want to be just selling people stuff.
Right.
I think you have to live with yourself and know that you're doing ethical things. And if there's science there, then that's great. But if there's not, then we can't be doing that.
It's just about making money for the beauty industry.
Unfortunately, it's a multi-billion-dollar industry. It's going to
Right.
keep it's not going to go away.
Because
So
we all want to look beautiful.
we want to fight the clock. Yes.
Right.
We want to fight
Exactly.
that.
As long as we can, we want to fight it. But there is a day where you just like, I'm done.
You just want to look the best you can for where you're at.
There you go. Exactly. Exactly. Wow, that's
So
wonderful. Well, it's been a lot of good information. We can't thank you enough for coming on and sharing all your knowledge and information.
what
Somebody
it,
said really quick, what about collagen pills? I guess it would be the same as collagen
Yeah.
powder. Yeah.
yeah,
Not enough science.
well, and when people come in, and I have several patients that are taking that, and they say that my skin's never looked better, my hair, everything. And I'm like, that's great. I don't ever try to tell people to not do things if I don't know that that's not right. I just don't think I don't know enough, and I haven't seen enough evidence for me to jump on that bandwagon. But that doesn't mean that people are doing it and they're happy with the results, that I would say you need to stop that. So if somebody says, what do you think about the collagen pills? I would say it's what you said. They've kind of gone down to low molecule, easy to absorb. So it's not, because the stomach has the most strong, 0.1 molar stomach acid. And the stomach's job is to destroy proteins, which is what collagen is. So if you're taking this stuff, it just gets, it's going to get manhandled by the stomach. So how much is getting absorbed into your GI system and then out to your skin is questionable. Now, these small portions, just like if you're doing sublingual things, it gets absorbed quicker. And so sometimes it will bypass all that stomach, churning and destruction. So you want to get it in a form where it can get absorbed. So
What
I think
about what about the microdosing, where you actually inject small amounts, like every day?
that probably has a better chance of working. But again, I haven't seen any studies on that. I don't want to promote that over. I just don't know. And so
Yeah.
I'm not bashing it. There's someone could call me up and say, here, look at some papers, and I'd be happy to look at them. I just haven't seen it in the derm literature enough to support it.
So tallow honey. Everybody wants to know, what about tallow honey? I don't even know about tallow honey. What is it?
I don't know, except for, honey is one of those healing, it's a very good antimicrobial and a healing agent. And I guess the tallow part is that it's, I don't know. I've heard people doing it, but I don't know enough about that one it seems,
That's the new
kind of,
craze. The tallow
it,
is the new craze.
it's like turmeric,
Yeah,
it's like certain things have kind of had their wave and then they fall away. I think if it was still part of the wave, we'd all be using it. So,
that's true. Somebody
but
says another question is, how about under eye bags?
it really depends on, what they're calling a bag. We have fat pads, which God gave us under the eye. And what happens sometimes is when people think, oh, I got these bags, what they've really done is they've lost skin and fat here. Women, especially petite women, when they get through menopause, they start to get osteoporotic. And so your body starts your estrogen is really good about keeping calcium in the bones. So when you lose that, you start to lose calcium. When you lose calcium, it's going to steal it from everywhere. It's going to steal from your pelvis, from your spine. But in women, it steals it from the face. They've had cadaver studies where they've taken women in their 40s, 50s, and 60s and look at skeletals at the skull, and they see that their orbits start getting bigger and bigger as they get into their 60s and 70s. So you're actually absorbing calcium from this zygoma, from this orbital rim. And what that does then, if that's holding up the skin, when that starts to go away, your skin's going to sag. And when you lose that volume here, then you create a tear trough, or you create, so this fat pad is not suffering from that. So the fat pad stays, and now you have a trough underneath it. So when people say, oh, I have eye bags, it's like, is that truly extra fat there? Or is that you've lost so much volume right here that now you see a bag? And if that's the case, then sometimes you can do, some people just need a lower bleph. If it's just sort of extra skin and, there's no cream that's going to work, there's really not a laser or microneedling that's going to make a difference. If it's just kind of a little bit of crepey, a little bit of loss, you could do microneedling, or you could do laser that'll help to tighten that. Or if it's really a trough that we're seeing, then you can take a filler, one of these HA fillers, which is the hyaluronic acid, and you kind of come in with a little cannula, and you go this way, and then you just inject it, and it'll just pop it right out. You have to watch those. Sometimes we've kind of gotten in our, I don't know how it happened, but in our beauty thing is that these big cheeks are in. And so if you fill this in too much, it actually changes the shape of your eyes, and it almost kind of makes your eyes too narrow. Because when you smile, your cheeks go up into your face. And so if you fill this in and then you smile, you just have these slits for eyes. And so I think you have to really kind of watch. That's why I think it's real important to kind of look at someone and see the way their face is, and see where they need to kind of get this, where they need the product, because it's not all the same. And I think it's not always just the eye bags. There's actually something else going on under it. They're just attributing it to an eye bag, which it's not that at all. So that's my take on it.
The key is that don't just do gimmicks online. You really need to see a specialist, a dermatologist, that knows stuff.
Yeah, or a plastic surgeon, someone that's kind of aware of the anatomy and where these vectors are happening and where what we want. Because I always tell people when they come in, it's like, tell me what bothers you. Because if I don't fix that, you're going to look at yourself every day in the mirror and go like, oh, I still see this. So let's fix the thing that bugs you the most. And then when that's better, then you can say, okay, wow, what else can,
sometimes
not that you're so critical of yourself. I think sometimes that's a problem is patients come in, sometimes they say, I'll tell them, you're the only person on the planet that sees that,
I'll have a patient that
this
comes
thing that
in.
you're complaining about.
I've had patients that come in, they have one little bitty chip tooth. You can't even see it. And yet they have this huge dark mole on their forehead. And I'm thinking to myself, what is going on? That needs to be more addressed. So yeah, it's just important.
It's hard to get in people's head sometimes and see what they're, and anyway, yeah. So you kind of just, it helps to go to someone who at least knows. I try not to do, you can always do something. I try to look at them and not do any more than they really need, because you can get caught up in what you think you need. And that's just I don't think anybody sees it as much as you do. So, but there's definitely a lot of neat products out there, and the laser technology has improved, the fillers. When I started practice, we didn't have Botox. We didn't have any of the fillers. And you basically had to go to plastic surgery, or you could do dermabrasion or a really strong laser. And now there's so many more subtle things you can do that can really kind of enhance things without going over the top and really changing your look. Because I think in the end, if you change too much, people don't know, you're now a freak. You're not, you haven't been improved. You've kind of been done too much.
What about red light? Red light mask. That's a great question. What about red light in general?
That's sort of a new frontier. I think we're seeing it more with hair growth. We're seeing it more with some rejuvenation. I don't think it hurts. When people come in, I kind of say, well, how much are you going to pay for it? The mask or the thing. If it's reasonable price, I think it's reasonable to do. If it starts becoming too high priced, I don't know if I have seen enough positive data to go out and pay for that. I think there's better ways to spend your money.
Good point. That's a good point.
But I don't think it's going to hurt. So kind of like that, when people say I've loved it, it's working great for me, then I'm like, awesome. There's so
I
But
think
it
too,
is,
different people, different things work for different people as well. Not one, like you said, it's not a one-stop shop. Everybody's different. All of our bodies are different. So you
yep,
really do
there.
have to find what works for you.
And you have to look different parts of the country, like Houston is very humid. So there are things we can
Mm,
use here that you give to someone in Colorado or Arizona or someplace, and they just need just a totally different product line.
mm-hmm.
And then there are people that have just in general oily skin or dry or sensitive skin. So you're right, it's not a one-stop thing. You have to kind of, have some options.
Very customized. That's
Yeah.
why it's
Very.
important, yes, to
Well,
see a
thank you,
specialist.
doctor. We don't want to take up too
Thank
much of your
you.
time. Thank you so much for coming on. We've learned a
Yeah,
lot. We really appreciate it. And if
I'm just so glad
anybody's in
to be here.
Houston, go visit you.
he's
Definitely.
great. I go in all the
Well,
time. And he's got a great injector,
Okay.
Valerie.
Well, we'll put
Valerie's great.
well,
your name and your practice. We'll put everything in the comments because we're going to post this live. And so everybody can go back and watch it again, and all the information will be on there.
well,
So
thank you
thank
so
you.
much. It's been so fun with Terry. She's as fun in person as she is on screen.
We love
So
Yeah,
our
we had
Terry, that's
fun.
for sure.
yeah.
All right.
Well,
Thank
thank
Thanks.
you
you,
guys.
Dr. Honey.
All right.
Thank you very much.
All right.
Good
All
night.
right,
Bye.
you
All right.
guys, everybody have a
Bye.
great time. Great
Bye.
Bye.
night. Bye.